Justice Solomon Bosa, who is now a very, very senior judge in The Hague, was our first chairperson. She was the head of the Law Society at that time, 93-94. Esther Kisache, Honorable Lady Justice Esther Kisache, who sits at the Supreme Court today, was one of those that came out very quickly. Dr. Yusuf Nsubuga, a past commissioner in the Ministry of Education. Beatrice Were, an acclaimed HIV and human rights and women's activist. And many names such as that. Margaret Sekaja, the first chairperson of the Uganda Human Rights Commission, was our second chairperson. So those were the great leaders and the vision bearers of the Uganet that we speak of today. They were the lawyers then, much younger, that pulled their weight behind the national challenge, that asked lawyers to come and make a contribution and challenge stigma and name it as a human rights violation. So that is the background within which Uganet was born. So what is its vision, its mandate, and its mission? Being a social justice organization, Uganet was established and up to this day is still addressing human rights related abuses in the context of health, now to include HIV, but mainly to also address rights violations that impact on women and girls. So it is addressing all forms of human rights human rights violation caused by health conditions such as AIDS from where we were born, and then later on strengthened the focus on women and girls and the vulnerability that besets them. Our kinds of focus are on two pillars. A pillar that is clear on our mandate in the health sector, addressing health conditions without losing focus on our core, that is the impact of HIV/AIDS on communities amongst people that it challenges. But also other health issues such as cancer and palliative care, the plight of a person living with an illness, having an illness, who is treated with indignity many times, who is desperate for support and care, but because of their vulnerability might be looked aside. We meet many of these in cancer wards, being left there to die with no one watching, with no one caring. The human rights spring that we have within us arises to support such patients or people living with conditions. So we care for HIV, we care for TB, we care for other conditions such as cancer, but also all patients that need palliative care. We believe palliative care is a human right. Then the second strand of our work is focus on women, everything women and girls. Uganet believes in the well-being of women and girls. When we are dealing with all these issues around health, we find that the core of the vulnerability and the violations, the one that bears them the most in our programming we've learned for over now 25 years, is a woman and girl to a larger extent. So because of what the work taught us, we strengthened our focus on women and girls. And what is it that we do with them? What are the 4 strategic pillars that Uganet stands on? We use our voice. We are advocates. We advocate for the human rights or enabling environment around these 2 issues. We advocate with different duty bearers, starting with Parliament and all key MDAs, all key ministries and agencies that have a responsibility on enabling the environment to be more respecting, more enhancing, more supportive to people who are vulnerable and need it the most. If for the last 7-8 years, we've been working with Parliament on the HIV Prevention and Control Act, although passed when we had worked so hard to ensure that issues around criminalizing HIV and increasing, and having clauses in there that we thought were increasing stigma and discrimination. We worked many years to ensure that there is a change. To some extent, we had wins. The law was passed with a lot of enabling provisions. Those that we could not ensure that they got changed within the time when it was a bill, we took it to court, such that the court makes a determination on whether what was passed does not discriminate or increase chances for people that are more vulnerable to be discriminated. So that's our work around laws. We deal we do position papers, we advise government on many things, we engage the public to speak with us, we mobilize our communities to speak and come up with proposals on issues that can reduce HIV-related stigma and discrimination. So we deal with laws, we deal with policies, we deal with practices. Now, when we are advocating for these practices to change, we engage communities. We speak to them. We ensure that communities are knowing their part. In terms of advocacy, we've been out there mobilizing people to ensure that they address the power challenges that cause violence against women in homes, but also in public settings. We've run campaigns that ensure people understand the role they have and the power they have to curb the increasing levels of violence that continue to make women and girls vulnerable. So that is the work that we do in advocacy. Then we do a service. A service is legal aid service provision. We have access to justice program where we run walk-in legal aid clinics. Clients come in and they are able to get support. Then we do mobile legal aid camps where we go to different regions in the country and are able to provide legal aid. We have a team of about 13 lawyers. We separate and go into different regions. We ensure we mobilize, we speak, we comfort. We do what we can to ensure that the poor, the indigent, the vulnerable, those who would otherwise would not have afforded a lawyer, we make access to justice quite affordable and accessible for them. We have a specific program around violence against women prevention. We prevent, but we also respond. In terms of prevention, we have massive educational campaigns, community mobilization campaigns happening in the different parts of the country, in Tororo, in Kasese, in Bundibujo. We've been in Palisa, we concluded in Tungamo. In these districts, we engage with communities. There is a part of us that is very communal. We move and walk with community members, local council leaders, mothers union groups, the sheikhs and the priests, and business among us. We engage with communities to hold these very critical and sensitive conversations, but which we believe enable people to have their own power, do their own reflection, to find where they lie and their positions on violence against women. When people have knowledge, their attitudes get better. When their attitudes get better, they are able to support people that face, women and girls that face violence. And when communities do all those three, we start to see behavioral change and we register less cases of violence in those communities. But we also do the response work. We recently opened the Rising Woman Shelter and Wellness Center, where for those that urgently need help, they need to be evacuated from very traumatic situations in their homes, those who are facing violence from intimate partners call us, and we are able to do quick rescues, and then we take them to the Rising Woman Center where they get integrated services from psychological services to legal support to safety, to feeding, to encouragement, to, you know, all those are weaved into one program, such that when a woman comes when they were broken down, they leave when they are whole and almost healed, to be able to have a new life. We equip them with skills. They are able to generate a bit of resources. They are able to create a life out of their hands and be able to stand against the huge obstacles and barriers that they have in homes, in communities, and in their settings. Then we work with partners. There's a big part of us that believes we've been here for 20 years, 25. We know so much, we've learned so much, we've done so much, but if it stays with us, then we are not impacting effectively. So we partner with civil society groups, we partner with government. We have a standing relationship with different parts of government. We have a memorandum of understanding with Uganda Prison Service. We go in prisons and work with prisoners around their wellness, around their rights, around their next court appearances, especially those that fit in our category. We work with the jail sector. We have an understanding with the jails, with the judiciary. There's work that we are generating together. We have an understanding with the Uganda Police Force. There are different programs that we are running with the Uganda Police Force, and they've been so kind to let us in and work together and develop programs together. So that is a very cherished part of the programs that we run here. What have we achieved over the last 25 years? So much impact. I know for sure, as much as I know the side of my palm, that there are very many people that would be dead today, but are alive. They are alive because of the work of Uganet. There are very many people that would have lost their properties, but they have them because of Uganet. There are very many children that would be in homes without parents, but they are able to have their parents because Uganet fought, because Uganet intervened, and that makes us very proud people, that we've made a contribution to our country and that we've made a contribution to our communities. We know that there are women we've whisked away from trauma, from pain, from anger, from angry men, from gunshots. They are those that we count. We know that there were girls that were going through, they were about to get their abortions, they had nowhere to run from. We rescued those, and they are well. We know that there are policies that read differently because Uganet engaged. And because of policies reading differently, their impact and their implementation is supporting many women and men in all parts of this country. There is reason, there are attitudes that our leaders at different levels, in the Ministry of Health, in the Ministry of Gender, in the Uganda Human Rights Commission, in the AIDS Commission, that know better on how to address issues of vulnerable communities, because Uganet has been a voice and has been present. What challenges have we faced? Several, many. If there were not many, probably our work would be done. But we still have so much to do, because indeed we are addressing or influencing laws and policies that are engrafted in people's thinking, in our culture, in our biases, and we still have the huge obstacles before us. Stigma and discrimination due to HIV/AIDS, for example, is so real. It's a subject that has evolved, may not be as terrible as when Uganet was born in 1990, but is still very real. Very many people face stigma and discrimination, and because of that, Uganet needs to keep at work. We need to keep challenging the businesses that discriminate people coming to work who are positive. We are now challenging the policy of taking these many workers outside, out of Uganda, but because they are positive, they cannot be among those accessing employment. We are challenging our own government on some of the issues that they miss to see. For example, like that permits being given to people exporting labor. It is clear they are giving people export permits which are expressly saying HIV positive people cannot be part of this workforce. That is wrong. When our laws still have provisions in them that increase stigma, that increase discrimination, Uganet still has a challenge to deal with. So that is the context that we deal with. Look at what COVID did, how it ravaged our communities and homes. A very silent epidemic that we didn't probably shout as much and scream as loud as we did to COVID-19. Many girls, over thousands, are at home, will not be able to go to school, probably got HIV through the very many teenage pregnancies, are stuck with these little bones that they are born, that they are having, got very serious health deficiencies through the whole issue of childbearing when you're not yet ready. Because of that, Uganet has a challenge to deal with. We want to create an impact around what we can do to make it safer for women and girls. How has COVID affected our work? Very strangely and not in the most comfortable of ways. Like I've said, our workload has increased. Yes, we were always fighting for rights of women. We were always dealing with violence against women cases. Our lawyers have always been deployed. But in COVID, in the lockdowns, we never had any time to breathe. It was one case after another, running from one police to another, with challenges on travel, travel permits. But we had to work. We had to be present in between an epidemic. Even when you're not so sure whether you would get COVID in a rescue. Even when at some point we even had to buy the white gear and just kept it in the car, in case I need to rescue a person with COVID, but rescue them from a perpetrator who they shared the same home environment with. We went to that extent. That home didn't exist before COVID, but as we speak today, we are close to our 300th case. Imagine 300 girls and women in a period of not even 2 years, sharing one home. So COVID has given us a lot of work. In the home that you saw earlier, we have girls ranging from the age of 17 to 14 that are pregnant and who are telling us we want to go back to school. Yes, you've rescued us from sex slavery in homes, but can we go back to school? None of our programs had childcare or school fees. We are now going to find organizations that can provide school fees. If we don't find them, we are going to try to ensure that we get the school fees, but we are not returning the girls to misery and to torture. So that is what COVID did for us. In terms of our where's Uganet going? What do we see? How do we see our growth? We are rolling out our programs to be more authentic, to be more efficient. We want to be a true partner to Ugandans, to communities that believe in us, that have access to us. We are growing. We are building our home in Buwate. We are asking well-wishers and friends to join us on this drive. We already started. We are coming out of the ground and getting up. We want the home for women and girls, the wellness center, to be truly a well-being center. One that will recapitulate life, will give back hope, that will give skills and enable many women have safety, enable many women have wellness, and those who need it and come out of it are able to live a very effective and efficient lives. So we hope to build our dream around Rising Woman, to have more centers because the need is much. That is what we hope to be doing. with the pride of the work that we have seen and done and achieved in the HIV movement. We are critical actors in the AIDS movement. We are very critical actors in the women's movement. Those are the things that hold us. Working around the vision to end AIDS and working around solidarity and strengthening of women and the voice of women and girls in this country. We want to appreciate our partners and our friends globally and nationally and communally, because we work at all those levels. We have global actors. The UN has held our hand in many different ways. Most of these programs are funded by the UN Women, supports our work on women and girls for prevention and response. We cherish and appreciate the Global Fund to end HIV, AIDS, TB and malaria. Through the Ministry of Health, we access funding. Through SACCO, we access funding. And this funding has enabled us to be great champions for human rights issues around HIV, TB, malaria, and other health conditions. We want to thank partners like the Open Society that have enabled us to be strong. We are grateful to all our civil society partners. This is such a huge elephant that you can't deal with it alone. We walk on the shoulders of others. We've been held by giants. Our civil society partners, NGOs, women in the women's movement, and women and men in the AIDS movement hold us. We belong together, and we are indebted to them. So I would like to appreciate UBC for the opportunity to want to know about us and follow our story. Thanks to UBC, thanks to the Ugandan government. Thank you so much for having an interest in our growth and in our story. We thank you so much. Thank you for listening.
Today, MTN Kabode, esimu ya smart josobola okwefunira olwo n'ogisasula mpola. Nkugambye yene erye ya kabi ate nga tamanyi endala zonna.